thought you would be excited to meet the baby that grew in you for 9 months. To meet, to hold him, to be his mom, and take care of the little human being that was growing inside of you for 9 months. And finally bring him home. But instead you feel as if you can't take care of this little human being, and you feel as if there is no connection between the two of you. A mix of outbursts of emotions, sadness, and guilt is what you might feel as if you can't take care of your baby. This is what a woman going through postpartum depression might be feeling and experiencing. This is how postpartum depression truly affects women. So what is postpartum depression? Postpartum depression is depression that occurs in a woman after giving childbirth. This causes a heavy outburst of emotions and a mix of heavy worry, severe anxiety, as well as pain, anger, and guilt, as well as the inability to bond with their child. So a woman feels as if she cannot take care of her baby properly due to the emotions she's feeling, and she doesn't feel a connection. Postpartum depression can develop from many things. There are many factors that play a role into postpartum depression. So we will discuss how postpartum depression develops and experience the emotions women may experience, as well as the struggles and treatment to help postpartum depression. So postpartum depression could develop from several things. One way postpartum depression could develop is peripartum depression, which is depression that occurs when a woman is pregnant. So then it goes from peripartum depression to postpartum depression. As well as hormonal changes, pregnancy causes an increase and decrease in hormones like estrogen and progesterone, which are a key role in pregnancy. So when these hormones fluctuate, it can affect the woman's mood as well. Genetic factors also have a play in the development of postpartum depression. So if your family has history of postpartum depression, there is a chance that you could be facing postpartum depression as well. As well as history of previous depression or bipolar disorders, these could help develop postpartum depression as well. And so then this picture shows you how it affects your brain and how the baby affects the mother's brain right here. And then the CRH levels that change in a woman. So women going through postpartum depression may experience emotions like extreme sadness, anger, guilt, anxiety, no bond with the child, loss of interest, lack of motivation, fatigue, stress, irritability, and sleep disturbance or deprivation. And these are the areas of the brain that are affected by postpartum depression. So postpartum depression can be cured with the correct treatment and help. Mothers can engage in hobbies like sports, eating healthy, exercising to distract themselves from what they are experiencing. As well as self-care, it is important these mothers take care of themselves and get the sleep that they need to alleviate symptoms. And therapy and counseling can help women express themselves and emotions. Some of these emotions they need to talk over with somebody. So therapy can help, as well as medication like SSRIs and SNRIs. Medications can help treat postpartum depression if needed as well. It just depends on the severity. And so my take on postpartum depression is, although I have never experienced postpartum depression or known anyone who has, I know it is a difficult experience for many women. I feel as if it is a battle women go through alone and don't feel understood when they're going through this. Although there are many doctors and support systems, I feel no matter what, women have to go through this emotional battle alone. And it is important, we all know the importance in being there for someone who may be experiencing postpartum depression. So I hope this speech can inform those who are unaware of postpartum depression and explain the battle women in motherhood face, and explain the struggles and help that we can help these women alleviate their pain and symptoms. Thank you.